Welcome to our deep dive all about echocardiography.
It's going to be a good one.
We're going to be exploring the fascinating world of how sound waves
That's right.
reveal all the secrets of your heart.
Exactly.
And think of this deep dive as like unlocking this hidden language
Yeah.
that tells us how your heart is actually functioning.
Yeah, for sure.
And we've got two awesome guides today from the American Society of Echocardiography.
The ASE.
Exactly.
Yeah.
Principles of waves and sound, and principles of flow energy and Doppler.
Love these guides.
I know. They're
so good.
They're designed for healthcare professionals.
Yeah.
But today, we're going to be your guides, and we're going to break it down
Absolutely.
and make sure you understand the key takeaway.
Yeah, it's like having a high-tech window right into your heart,
I love that.
showing us exactly how the blood flows through each chamber and valve.
Exactly. So let's start with the basics.
Okay.
How does ultrasound actually work?
All right. So,
What are we talking about here?
we're talking about sound waves, right?
Okay.
So imagine dropping a pebble into a still pond.
Okay.
You see those ripples spreading outward?
Uh-huh.
That's exactly what ultrasound does, sending out these pulses of sound waves that travel through your body
Okay.
and bounce back to the machine.
So it's like an echo.
Yes.
Okay.
Based on how those sound waves return, like
Yeah.
how long they take
Uh-huh.
and how their frequency changes,
Okay.
we can create those black and white images
Yeah, the ones that we've all seen.
you might have seen.
Yeah.
And those images actually show the shape and movement of your heart in real time.
So it's not just a picture. It's like a video of your heart.
Exactly.
That's incredible.
It's really cool.
So cool.
And it gets even cooler.
Oh, gosh. Okay.
So the speed of sound actually changes depending on what it's traveling through.
What?
Yeah.
Okay.
It moves faster through dense materials like bone
Okay.
than through softer tissues like muscle or blood.
Wait, so sound travels faster through bone than air. That's crazy.
It's a common misconception,
I know.
but it's actually the opposite.
That's so wild.
So this difference in speed is actually what helps create those really detailed ultrasound images.
Okay.
It's all about how the sound waves bend or refract as they move through your heart.
So it's almost like mapping out the terrain of your heart.
Yeah.
It's revealing its unique structure.
Precisely. And one of the guides mentions Snell's law,
Oh, yeah.
which describes exactly how those sound waves change direction when they hit the boundaries between different types of tissue.
Oh, that's so cool.
Yeah. So it's a fundamental principle that helps us understand how those images are formed.
Now, you mentioned frequency changes.
Yes.
What's that all about?
That's where Doppler technology comes in.
Okay.
You know how a siren sounds higher pitched as an ambulance approaches and lower as it moves away?
Right.
That's the Doppler effect.
Yeah.
And it happens with sound waves and light waves.
I've definitely noticed that with sirens before.
Yeah, for sure.
So how does Doppler work with echocardiography?
So we use it to measure how fast blood is flowing through your heart.
Wow.
By analyzing the change in frequency of the sound waves bouncing back from the blood cells,
Okay.
we can determine the speed and direction of blood flow.
That's awesome.
Yeah, this is especially useful for detecting problems with your heart valves.
So the valves are those little doors in the heart
Exactly.
that control the direction of
Yeah.
blood flow.
There are 4 main valves:
Okay.
the aortic,
Uh-huh.
mitral,
Okay.
tricuspid,
Uh-huh.
and pulmonic valves.
Okay.
Each valve has these leaflets that open and close
Right.
to ensure that blood flows in the right direction.
Okay.
And Doppler helps us see if these valves are working as they should.
Yeah. So it's like a quality control check
Yeah,
for your heart's plumbing system.
that's a great analogy.
I try.
So to actually calculate the blood flow velocity,
Yeah. How do we do
we
it?
use the Doppler equation. It might look intimidating at first, but it basically connects the change in frequency to the speed of the blood flow.
So by plugging in those measurements, we can figure out exactly how fast blood is moving through the heart.
Yes.
That's pretty remarkable.
It is. And another equation that helps us make sense of all this is Bernoulli's equation.
Okay.
Might sound complicated, but it actually simplifies things.
Okay.
It describes the relationship between blood flow velocity and pressure,
Okay.
helping us understand how blood behaves as it moves through the heart, especially when it encounters a narrow area like a stenotic valve.
Stenotic valves.
Yeah.
Is that like a clogged pipe?
Yes, stenosis means narrowing,
Okay.
and when it happens to a heart valve, it can restrict blood flow and forcing your heart to work harder.
So all of these formulas and equations that we're talking about,
Yes.
these aren't just theoretical concepts.
Yeah.
Now we have real-world applications
Yes.
for understanding
Absolutely.
how efficiently
Right.
your heart is pumping blood.
Yeah, that's right. And in the next part of our deep dive, we're going to explore how these concepts are applied to each specific heart valve,
Ooh, I'm excited.
helping us diagnose and manage a variety of heart conditions.
This is already so fascinating. I can't wait to learn more about how all of this translates into taking care of our hearts.
Me too.
All right, well, stay tuned. We'll be right back. Welcome back to our deep dive. So we've just scratched the surface of echocardiography, and now I'm ready to get into the nitty-gritty of those heart valves.
All right, let's do it.
We've got our 4 main players here: aortic, mitral, tricuspid,
Yes.
and pulmonic. Where should we start?
Let's focus on the aortic valve first.
Okay.
It's kind of the gatekeeper between your heart's main pumping chamber,
Okay.
which is the left ventricle,
Uh-huh.
and your aorta, which is the largest artery in your body.
Okay, so it's a pretty important valve.
It is very important.
Go wrong.
Well, 2 main issues we look for are stenosis,
Uh-huh.
which is a narrowing of the valve.
Right, like a clogged pipe. Okay. And regurgitation, where the valve doesn't close tightly and allows blood to leak backwards.
Like a leaky faucet.
Yeah.
Okay, got it. So how does echocardiography help us figure out if there's a problem?
For aortic stenosis, we use those Doppler techniques we talked about
Okay.
to measure how fast the blood is being forced through that narrowed valve.
Okay.
The faster the blood flow, the more severe the narrowing.
So if you're trying to squeeze a lot of water through a tiny hose, it's really going to build up pressure there.
Exactly. And to quantify that pressure, we look at the mean gradient,
Okay.
which tells us the average pressure difference across the valve.
Okay.
And this basically helps determine how much harder your heart has to work
Right.
to push the blood through that narrowed opening.
So what about aortic regurgitation? How do we assess that leaky faucet?
So the Native Valves and Intracardiac Pressures Guide actually shows a few different ways to assess the severity of that leak.
Okay.
One is the PISA method.
Okay. I remember you mentioning PISA before.
Yeah.
Can you break that down for me?
Yeah.
Yes, PISA stands for Proximal Isovelocity Surface Area.
Okay.
Think of it like this. When blood leaks back through the aortic valve, it creates a very specific flow pattern that we can actually see on the ultrasound.
Wow.
The PISA method helps us measure the size of that backflow zone.
Okay.
And the larger that zone, the more severe the leak.
So it's like using the ultrasound image as a map to trace the path of the leaking blood.
Exactly. And by analyzing that map, we can calculate what's called the effective regurgitant orifice area, or EROA, which gives us a number that represents the size of that leak.
And so knowing that number helps doctors make treatment decisions.
Absolutely. It helps determine if medications are enough or if a more invasive procedure like a valve replacement is necessary.
Oh, wow.
And the guide even provides severity scales based on those EROA measurements to help guide those decisions.
Wow. So these numbers aren't just abstract data points.
No.
They're crucial for making informed decisions about your heart health.
Precisely. And the guide also mentions another method for assessing aortic regurgitation called the continuity method.
Okay, tell me about that one.
This one is based on the idea that what flows in must flow out.
Okay.
By comparing the amount of blood flowing through the aortic valve to the amount flowing through the mitral valve, we can estimate how much blood is leaking back through that aortic valve.
Interesting. So we have multiple ways to cross-check the information and get a really comprehensive picture of what's happening.
It all works together.
So now what about the mitral valve? Where's that one located and what kind of problems can happen there?
So the mitral valve sits between your left atrium, which receives oxygen-rich blood from your lungs, and the left ventricle, your heart's main pumping chamber.
So it's like the entryway into the powerhouse.
Exactly. And just like the aortic valve, the mitral valve can be affected by stenosis and regurgitation. And guess what? We use similar techniques to evaluate it.
So we're talking PISA
Yes.
and continuity method again.
You got it.
Okay, cool.
So for mitral regurgitation, we can use PISA to measure that backflow zone and calculate that EROA, just like we did for the aortic valve. And the continuity method helps us compare blood flow through the mitral valve to the left ventricle outflow. Again, to estimate the amount of leakage.
It seems like those two methods are real workhorses
They are.
for evaluating valve problems.
They really are. And for mitral stenosis,
Okay.
where that valve is narrowed,
Mm-hmm.
we focus on measuring the pressure difference across the valve
Okay.
and how long it takes for that pressure to equalize.
Okay.
A longer equalization time usually means a tighter squeeze,
Okay.
indicating the more severe stenosis.
So if blood is having a hard time getting through that narrowed mitral valve,
Yes,
it's going to back up into the left atrium.
exactly.
Not good.
Not good at all. It can lead to a buildup of pressure in the lungs, making it harder to breathe. That's why detecting and managing mitral stenosis early is so important.
Okay, so we talked a lot about the aortic and mitral valves on the left side of the heart.
Yes.
What about the tricuspid and the pulmonic valves on the right side?
Yeah. What about those?
Do they experience the same kinds of problems?
They do. The tricuspid valve controls blood flow between the right atrium and the right ventricle,
Okay.
while the pulmonic valve sits between the right ventricle and the pulmonary artery, which carries blood to your lungs
Okay.
to pick up oxygen.
So they're playing a crucial role in getting blood to the lungs for oxygenation and then back to the left side of the heart.
That's a great way to put it.
For circulation.
Exactly. Back throughout the body.
And like their counterparts on the left side, so tricuspid and pulmonic valves can also be affected by stenosis and regurgitation?
They can.
They can.
Oh.
But the good news is echocardiography can help us assess these valves too,
Okay, good.
using many of the same techniques that we've already discussed.
So it's like a universal toolkit for evaluating all 4 heart valves.
You could say that.
That's awesome.
Now, while those 4 valves are essential for healthy blood flow,
Right.
there are other situations where echocardiography really shines.
Like what? Give me some examples.
Well, what if your natural valve is so damaged it needs to be replaced?
Okay.
That's where prosthetic valves come in.
Prosthetic valves, so like artificial valves.
Exactly. And echocardiography is crucial for monitoring those prosthetic valves to make sure they're functioning properly.
Okay.
We can assess if they're opening and closing effectively
Right.
and check for any signs of leakage or blockage.
It's like having regular checkups for your artificial heart valve.
Yeah, like a tune-up.
That makes a lot of sense.
Keep them running smoothly.
It's reassuring to know that echocardiography can keep tabs on those artificial valves.
Yes.
And make sure they're doing their job.
It's a really valuable tool.
So is there anything else?
There's another area where echocardiography is incredibly valuable.
Okay.
Congenital heart defects. Congenital heart defects. So those are heart problems that people are born with.
That's right.
Okay.
These defects can range from simple holes in the heart walls to more complex malformations.
Right.
And echocardiography plays a vital role in diagnosing and monitoring these conditions.
So it's like a powerful lens
Yeah.
that allows us to see inside the heart and identify any structural abnormalities.
Exactly. For example, one common congenital heart defect is an atrial septal defect, or ASD.
ASD.
Which is basically a hole in the wall that separates the 2 upper chambers of the heart.
Okay.
The atria.
Okay, so what about ventricular septal defects?
VSDs.
I've heard of those too.
Those are holes in the wall between the ventricles.
Okay.
Echocardiography is also essential for diagnosing and evaluating VSDs.
Okay.
We can pinpoint the location,
Okay.
measure their size, and determine if they're causing any significant shunting of blood.
Shunting, what does that mean?
Shunting means that blood is flowing in a direction that it's not supposed to.
Oh, no. So with a VSD, some oxygen-rich blood from the left ventricle might flow back into the right ventricle instead of going out to the body.
Oh, wow.
This can make the heart work harder and in severe cases lead to problems with oxygen delivery.
Wow. So echocardiography helps us understand not only the structure of the heart, but also the dynamics of the blood flow within it.
Precisely. And we can't forget about other conditions like patent ductus arteriosus or PDA, which is a blood vessel that's supposed to close after birth but remains open.
Right.
Echocardiography allows us to see that open vessel and assess its impact on circulation.
And then there's coarctation of the aorta.
Yes.
That's where the main artery carrying blood away from the heart is narrowed.
You're on a roll.
That's right.
Yeah, echocardiography helps us identify that narrowing and determine how much it's restricting blood flow.
Okay.
This information is crucial for deciding on the appropriate treatment, which might involve medication surgery or a combination of both. It's truly remarkable how versatile echocardiography is.
It is.
It's like a Swiss Army knife for evaluating a wide range of heart conditions.
It is a very, very valuable tool.
From valve problems to congenital defects to performance of those prosthetic valves.
Absolutely. And believe it or not, we've only just begun to explore its capabilities.
Right.
There's so much more we can learn about your heart's function.
Oh my gosh. I'm already feeling overwhelmed in a good way.
I know there's a lot to take in.
With all this information, but I'm ready to dive deeper.
Okay.
What else can echocardiography tell us about the heart's inner workings?
Let's do it.
Okay, so we've covered so much ground already.
We have.
From the basic principles of ultrasound to Doppler and those intricate details of the heart valves. I'm ready for more.
Okay.
What else can echocardiography reveal about the heart?
So let's delve into the world of hemodynamics.
Okay.
It sounds intimidating.
It does.
But it's basically just the study of how blood flows through your circulatory system and the forces involved.
Okay, so it's like the physics of your heart and blood vessels.
Yeah, the physics of your heart.
And how does echocardiography help us understand hemodynamics?
It's like having a pressure gauge for your heart.
Okay.
Echocardiography allows us to visualize blood flow patterns, measure how fast the blood is moving, and even estimate pressures within the different chambers of your heart.
So we can actually see how hard each side of the heart is working.
Precisely.
Okay, I like that.
Let's start with the right side.
Okay.
This side is responsible for pumping blood to your lungs to pick up oxygen.
Okay.
And page 11 of our native valves and intracardiac pressures guide actually highlights some key formulas for estimating right atrial pressure, or RAP.
So RAP, that's the pressure in the right atrium.
Yes.
The chamber that receives blood from the body before sending it to the right ventricle.
Exactly. And elevated RAP can be a sign of things like heart failure, or pulmonary hypertension.
Pulmonary hypertension, that's high blood pressure in the arteries of the lungs.
That's right.
Okay.
It's a serious condition that can make it really difficult for your heart to pump blood effectively.
Wow. So by measuring RAP, we can get a sense of how well the right side of the heart is handling its workload.
Yes.
And if there are any underlying issues.
Exactly. And we can take it a step further by looking at mean pulmonary artery pressure, or MPAP, which is the average pressure in the pulmonary arteries.
Right.
This gives us even more insight into the health of your pulmonary circulation.
And what about pulmonary vascular resistance, or PVR?
PVR.
Yeah, I remember seeing that term in the guide as well.
So PVR measures how much resistance the blood encounters as it flows through those pulmonary arteries.
Okay.
Think of it like trying to push water through a narrow pipe versus a wide one.
Okay.
The narrower pipe creates more resistance.
So high PVR means the blood is having a harder time getting through the pulmonary arteries.
Yes.
Which puts more strain on the right side of the heart.
Exactly. And elevated PVR is a hallmark of pulmonary hypertension.
Wow. So echocardiography can really pinpoint problems with the right side of the heart and the pulmonary circulation. Now, what about the left side?
Okay.
I know page 9 of the guide focuses on left heart hemodynamics.
Yes, so one of the key measurements on this side is left atrial pressure, or LAP. This reflects the pressure in the left atrium, which receives oxygen-rich blood from the lungs before it enters the left ventricle.
So LAP tells us how much pressure is building up in that chamber as it receives blood from the lungs.
Exactly. And elevated LAP can be a sign of problems with the mitral valve. Or the left ventricle itself. For instance, if the mitral valve isn't opening properly, it can create a backlog of blood in the left atrium, leading to increased pressure.
So those pressure measurements can give us clues about the health of the valves and the heart muscle itself.
Precisely. And the guide even provides formulas that take into account mitral regurgitation if it's present, allowing us to get a more accurate assessment of LAP.
It's fascinating how echocardiography allows us to indirectly measure these pressures inside the heart. Yeah. It's like having a window into the forces that drive blood flow through the entire cardiovascular system.
It really is. And speaking of those forces, let's talk about diastolic function assessment. Diastole is the phase of the heart cycle when the heart muscle relaxes and fills with blood.
So it's all about how well the heart can relax and receive blood before it pumps it out again.
Exactly. And this relaxation phase is just as important as the contraction phase.
Wow.
Page 10 of our second guide, Echocardiography Formula Review Guide Part 2, outlines the key parameters we use to assess diastolic function.
And the guide mentions things like left atrial volume index.
Yes.
Mitral annular tissue Doppler velocities. And the EA ratio.
Right.
Can you explain what those are?
So these parameters help us understand different aspects of diastolic function. For example, the EA ratio compares the velocity of blood flow during early and late filling of the left ventricle. This can tell us if the left ventricle is relaxing properly and receiving blood efficiently.
So it's like checking the timing of the blood flow to see if it's synchronized with the heart's relaxation phase.
A perfect analogy.
Thank you.
And on page 11, we see another important ratio, the ease ratio, which helps us estimate left ventricular filling pressures.
Filling pressures?
Yes.
What are those?
So it's the pressure inside the left ventricle during that filling phase. Elevated filling pressures can put extra strain on the heart and lungs, and they're a sign of diastolic dysfunction.
So it's like checking the pressure gauge again to see if the left ventricle is having to work too hard to fill up with blood.
Exactly. And if the filling pressures are high, it can lead to symptoms like shortness of breath and fatigue.
Wow. So echocardiography can really pick up on subtle changes in the heart's ability to relax and fill with blood. This diastolic function assessment seems so crucial for understanding the heart's overall performance.
Absolutely. It's a key piece of the puzzle when we're evaluating your heart health.
This has been such an incredible deep dive.
It has.
Into the world of echocardiography.
It's pretty amazing.
We've gone from the basics of sound waves to the complexities of heart valves, hemodynamics, and diastolic function.
A lot of information.
It's amazing how much information we can glean from this one technology.
It is, and remember, echocardiography is constantly evolving.
That's right.
New technologies and techniques are being developed all the time, allowing us to see even more detail and gain even deeper insights into the heart's intricate workings.
That's so exciting.
It is really cool.
I'm feeling inspired to learn more about specific heart conditions or echocardiographic techniques.
Yeah.
That really caught my attention during this deep dive.
That's great.
The American Society of Echocardiography website seems like a great place to start.
Absolutely. And there are so many other reputable cardiology resources available online.
Yeah.
Just remember, knowledge is power when it comes to your heart health.
Well said. And even though we've explored all the technical aspects of echocardiography, let's not forget that it's ultimately about caring for the human heart.
That's right.
The very essence of life.
That's a beautiful reminder. Behind all those formulas and measurements lies the beating heart, a symbol of strength, resilience, and the very rhythm of our existence.
I love that.
It's an honor to use these tools to understand and care for this vital organ.
Well, thank you for taking us on this incredible journey into the world of echocardiography.
My pleasure.
It's been an eye-opening experience for sure.
I'm glad to hear that. So remember, stay curious, keep learning, and take good care of your heart.
And thank you to all of our listeners for tuning in to this deep dive. We'll see you next time.